How's that arm feel?
Like warm.
Little better?
Kind of like how I felt with my ankle. It's like blood's flowing where it hasn't been able to flow in a while.
Yeah. I mean, I really think that the best thing about it isn't even just like the fact that we work on it. The fact that like the apprenticeship is allowing you to work ongoing.
Yeah.
So like your last session with me was the best that I've had in like ages.
Heck yeah.
Because you really got it. Because it's like you started going off script with me working with you. Whereas like you felt okay exploring like muscle insertions and like, what is that right there? And I'm like, oh, yeah. So it's like, I mean, I think I'm having a challenge breaking down more like rudimentary skills to be able to explain to students exactly how to do stuff. But over time, I should be able to make it more step 1, step 2, step 3 and sequential to give them kind of a basic idea of how to work on stuff. And then through the upper portion here.
Yeah.
And there. If I go up into here, how's that?
Tight.
Okay. Is it a little bit lower or just like a little bit higher?
Maybe a little bit low. I mean, where your palms at, all that.
Okay. So if I hang out like right there for a second.
Ooh. Ooh.
Oh yeah. Right in there. I'm starting a fire.
It feels like it.
Is that too much on your tricep right there? Okay. Feels like it's opening it up slowly.
Yeah.
Yeah. I can't imagine if they just set me loose at a massage school for a day. Like, Robert, show them stuff. It's like throwing a monkey wrench in their curriculum. Yeah. Go a little bit more lateral out here. Is that as good?
Yeah.
Okay.
You hear my elbow popping?
Cracking?
I think it's my elbow. Oh no, it's just moving.
Ooh. Ooh.
Oh yeah. That's good.
Oy. I'll lift that up. There we
How
go.
cool would that be if there was a school that includes high in it for?
They will eventually, but
Oh,
it's
so far ahead.
it's a breaking. Well,
I mean, it took me. I mean, okay. Well,
I think there would be arguments about whether it'd be a good idea or not.
why is that?
Well, because the whole curriculum is based on Swedish
Yeah.
as the foundation.
Swedish sucks.
Well, but if you say that to Tim, he'll start to like clash with me about it. But why do you think Swedish sucks?
Because it's. I mean, it's good for like old people. Like, it's good for elderly and for like, I guess it's better than nothing. But it's just so superficial. It's
Right there.
insanely boring to me.
Right there.
Yeah.
Well, here's what happens with me.
I like this too.
And I'm somebody
That's
who
nice.
suffered chronic pain, right? So the pressure underneath, big and broad.
Nice.
Like for some people, it'll hit like part of their bicep. Some people
Yeah.
will start to get a little, especially if they've never had it. They're like, my hand's going numb or, whatever.
Yeah.
But the thing is, this is big, broad pressure underneath.
Nice.
And then this is still fairly broad back here.
I like that.
But I'm also like protecting your shoulder joint because this is kind of lifted up.
Yeah.
Yeah. So, one, I think effleurage is safe for a really broad portion of the population.
Yeah.
Even broader than this. This is, I mean, you know, I don't put advanced in all of the titles on the videos, but I think this is more advanced. If massage therapists see this, they're like, what the hell, oh my God, what is he doing? Like, I've never seen anybody do that, you know? I mean, that's the massage culture we're dealing with. I feel like you could teach what's needed in a 500-hour curriculum and include Thai, and you wouldn't have to include as much effleurage. I don't think it would be necessary. I don't even really feel like that's what clients are asking for. But like, you draw more people who are in chronic pain, right?
Yeah.
Yeah. See, your target market's more like mine. Tim can work on chronic pain, but he still likes, he'll talk about relaxation more than I do.
Yeah, well.
But here's the thing, do you find what we do relaxing?
Yeah, and I'm fighting to stay awake.
See, and that's what, like, it's weird.
I'm the same way.
Because there's all this
the same
crazy
way.
jostling, and some people are like, dude, I want to relax. Like,
This is relaxing.
why are you shaking me out? But the
You're
thing is, if I get
rocking baby.
effleurage, here's what would happen. I would get irritated because it was kind of like I had an itch and they were like scratching the other shoulder blade.
Yep.
And I'm like, would you please like hang out and press on that? Like it hurts. Yeah, right there.
Yeah.
There you go. Oh. What do you think? Up.
Oh.
Back.
Up.
Now, if I hold her here, can you move it? You can move it any way you want. There you go. Then you'll get into an argument where, like I made a meme, the Crowder meme. It's like, Thai massage is more effective than deep tissue. Massage therapists lose their mind. They get all kinds of angry. Like, Thai massage is more effective than deep tissue. And they're like, rah, 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 and they're arguing about technique, and they're arguing about how you're interacting with tissue, and they're arguing about how much oil, cream, lubricant you use. And I do it to poke them, like to like shake them out of their torpor. Because I think Thai techniques with compression are deeper than deep tissue. They feel deeper to me. Right there.
Oh, yeah.
Right there. So I could feel like this line, I could just feel this line right underneath my forearm as it sank through. And it's just like dense, just right there. If I go up and down, it's back and forth. The back and forth is better?
It's all about the same.
That's same.
Wait.
If I go up towards the shoulder or down towards the elbow?
Right there?
Right there?
Uh-huh.
Ooh, that feels like a different arm.
Doesn't it?
Oh, this is like, it's like you just
Well, you
pick
can
it up
touch
and
it.
wrap it around your humerus. And then, yeah, back towards your rotator cuff over here. How's this?
Good.
Oh, this is tender. And all this in here.
Whee! That's so ticklish.
Yeah. It's a little ticklish, but is it tense in there at all?
Yes.
Yeah, right there.
Ticklish and it's tense.
But you're using this to stabilize the head of your humerus while you're doing all that work pressing on people. How's that in there?
It's tight.
But it also goes back to where the bicep like is inserting over here. How's that?
Yeah.
There we go. And I'm like, okay, I'm gonna work on the other side of the back. How's that? How's that?
Good.
Up or down?
Whee. Up.
Right there?
Yeah.
There we go. And then people are like, oh my God, he makes all this passive body contact. It's creepy.
They're ridiculous. So I could creepier, it'd be like weirdly apart.
See, that's how it always feels to me. Like, it feels totally weird to be like, like, I don't know. Is that your elbow cracked?
I know.
How's that?
Feels awesome.